giving new hope to cancer patients like Melissa Durant.
The fact that I couldn't have children really scared and frightened me.
2 years ago, at the age of 21, Melissa was diagnosed with Hodgkin's lymphoma. She was told her treatment would include very high doses of chemotherapy.
I thought, I'm young, I can do it. The odds are looking really great for me. Hodgkin's lymphoma, very curable. And then I really started looking into my papers and my books that you get, and I came across fertility, and I burst into tears.
When she found out the chemo would make her infertile, Melissa turned to Dr. Silber. In a simple outpatient surgery, Dr. Silber removed tissue from her ovaries. Since all of the eggs in a woman's ovaries are located on the outer rim, only a small incision was needed to dissect the thin outer membrane from the ovary and remove it. The tissue was then put through a computer-controlled, gradual freezing process. By counting the follicles, which are the little black holes in the outer part of the ovaries, Dr. Silber can actually count a woman's eggs.
When you come in and have your antral follicle count ultrasound, plus some simple hormone tests, but the ultrasound is the main thing, we can tell you where you are in your biologic clock.
That's something Melissa will never have to worry about. She calls it the one positive from her cancer diagnosis.
I don't have a biological clock anymore. He took it away from me. So when I'm ready to have kids, it's not going to be a problem.
Well, Melissa, this is a fantastic moment for all of us.
It is.
I mean, when are you going to have the baby?
We are scheduled for a week from yesterday, so six more days.
6 more days, and you look really ripe.
I am very ripe, yes.
I mean, I just remember, how many years ago was it that you were sitting here at this table and so optimistic about your Hodgkin's? I remember you said Hodgkin's disease, very curable.
Very curable. I have relapsed since, but with advances in medicine again, I'm been in remission for 5 years.
Fantastic.
Mm-hmm.
Well, we've had a lot of patients like that.
Mm-hmm.
They went into relapse, but then they were finally cured a second time.
Yes,
Yeah.
yes.
There was that first patient even that the first ovary freeze we did was 1996 or 7, and her frozen ovary is still working. She's had 2 babies already.
Incredible.
And that's from 1997. And so I can say this because, I mean, she went public on all this, and she is a oncology nurse at Children's Hospital.
Wonderful.
And I remember it very, very well that she went through several relapses, and now she's fantastic. And I mean, there's no trace of anything. So
That's great.
But I remember you said you were so optimistic. You said very curable, but then I read about fertility.
Oh, yeah. Oh, yeah. No one tells you about the fertility part. They just want to treat you, cure you, and move you on with life. But you don't realize that when you go through as much chemotherapy as I had to endure, it puts you in the menopause.
And nobody really told you that. You had to read about that.
They give you a lot of books to read, a lot of pamphlets.
Okay.
But then, no, that is not on the top of their list by any means when it comes to helping, save a life.
Yeah, well, because they want to save a life. They don't think about the fertility usually. It's up to you. And so, how did you wind up coming here, even?
A friend introduced me to Dr. DeRosa as an OBGYN, and that's how I got to you.
And that's how you found out.
Uh-huh.
Yeah. And your oncologist wasn't too unhappy when they found out about it?
No.
Well, they were okay. Go ahead and do it.
She wasn't upset by any means. She will not let me come to appointments now without bringing the baby.
Fantastic.
Mm-hmm.
Oh, that's really great. Oh, that's good.
She's so excited.
But I remember you saying something, and I do quote you. If I'm correct, I want to make sure I'm quoting you correctly. That in a way, you're really glad that you had cancer, because otherwise you wouldn't have preserved your fertility.
Yeah, I wouldn't. Absolutely.
I mean, how old were you when we first saw you?
21. I was 21 years old when you took out the ovary, and I am 34 now.
Wow.
Mm-hmm.
13 years later, you're going to have the baby.
Yep.
And we still have plenty of good quality ovary left. I mean,
There's plenty in there.
and they're not going to have a shelf life. So, if your husband could tolerate this, you could come back whenever. This is going to keep functioning for a while.
Mm-hmm.
But let's say it stops functioning in 5 years.
Mm-hmm.
You know, and you're 39. You could come back and put another piece of ovary put back.
Let's do it again.
Do it again. Right.
We'll make a basketball team.
So you're going to have a C-section, is that right?
I am. She's measuring just a little large. So Dr. DeRosa would rather do it the safe way.
Be safe. Yeah, I don't want to be offensive, but
No.
you do look big.
Yeah, she's.
And you haven't gained weight. I see that. You look fine.
Thank you. I haven't gained much. I have been pretty healthy this pregnancy, but she is taking it all in.
Oh, well, that's cool. Well, I'm looking forward to that.
Yeah.
So, you know that once you deliver, the ovary is going to keep on functioning. And so, are you going to nurse or?
Yes.
Okay.
Fully plan to.
So whenever you stop nursing, don't be shocked, but your periods will come back.
Mm-hmm.
I suspect this ovary will last. This little piece of ovarian tissue is going to last a long time.
The little piece that you quilted.
Yeah, that we quilt. Oh, you know what, the quilting.
I remember you quilting.
Any advice for either young cancer patients or for just women who are worried about their biologic clock?
Well, I think the word, if it's not out there now, needs to be out there for women who are young, diagnosed. I mean, my type of cancer, Hodgkin's lymphoma, usually affects women late teens, early 20s. Fertility is the last thing on your mind when you're in high school, college, maybe just starting a career. So if the information's out there, if they are diagnosed, then they need to come to you. They need to come see someone because they need to have this.
Yep, and most of them, most frankly, the young cancer patients who can have this done don't know about it, or they're afraid, or they're concerned about the finances, and so.
Oh yeah, there's a lot of reasons why you would be hesitant.
You just held your abdomen. Is there a little kick going on
Oh,
there?
you want to feel her? Yeah.
Okay.
She's got the hiccups. There it is.
Wow, that's fantastic.
You feel it?
Oh, it's cool. Oh my God, that was a real strong one. There's another strong one.
Yeah,
awesome.
She's gonna be a tough girl.
Awesome. All right. Well, that's
right.
great. It's great to see you again.
It's good seeing you. Thank you.
Thank you.